Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your welfare, longevity, and well-being. Tonight's program is entitled The Colon and Its Effect on Your Health. The reason for covering this topic tonight is as a practitioner of acupuncture, Chinese herbal medicine, and a naturopathic physician, a tremendous amount of patients come in to see me for disorders related to the gut and lower bowels. I feel that doing this program tonight will help to give you viewers at home some parameters for understanding what type of practitioner to use and things that you can do to help your lifestyle in controlling some bowel-related issues that you may have. Some frequent related problems that we have that we've come across, number one would be chronic constipation, chronic or diarrhea, colitis, irritable bowel syndrome, diverticulitis, and this is just to name a few. Before we go on tonight, I'm going to start with my little inspirational message tonight to you, and it's a little story that I want you to extract something out of for yourself. First of all, you decide to do something good for someone, and you're going to go out and you're going to fix them a meal. So you go to the store, you buy the turkey, you get all of the fixings, you go home, you prepare it, you get everything all set up, you take it to the person's house, you get everything all ready to eat. The person comes in and says, "But you know I don't like cranberries." The lesson to learn from that story is, of course, the fact that you need to think about where you're putting your energy of helping. And sometimes there's certain circumstances in life that no matter how much energy you put into it, you can't help that no matter what you do. The second thing is, before we start our anatomy lesson, I want to go over something that's very important issue and something that we can all have control over. The world that we live in is exposed to a lot of toxins, a lot of pollutants, and a lot of abnormal things that influence our health. The quality of the water that we're exposed to is something that you, as a person, can directly influence what you're taking into your body. Water is a wonderful nutrient that gradually people are taking more and more, drinking more and more water, and eliminating the sugary carbonated beverages that they've taken in at the tremendous rates years ago. So it's good that people are drinking water. The big fallacy that's going on is that the water that you're drinking from your tap is good for you. I would, under no circumstances, drink tap water. I would do not drink it at all. And you're going to go with either bottled water, or you're going to use this is what I want you to do. I want you to invest the money, and you're going to go to Home Depot, and you're going to pick up yourself a reverse osmosis system. The reverse osmosis system eliminates practically all forms of pollutants, all forms of residue, and anything that would be unnatural for you to take in as far as your drinking water is concerned. It used to be that a reverse osmosis system years ago was a couple $1,000s. I bought one from GE the other day and installed it in my home. $250 that unit costs. It's amazing because in just a very short period of time, that thing will pay for itself in 2 to 3 months, and you'll be much more healthier, and it's the purest form of water that you can possibly get. So I want you to really seriously consider that, because it'll pay for itself in no time. The system makes about 10 gallons of drinking water, which you can also use to cook your food in. That's the problem with buying the bottled water, is that it gets to be expensive. Like, I used to have the service come to my house with the big water jug, and it's a great thing, but you're going to drink that water, but you're not going to use that water to cook with because it's too expensive to do so. But with the reverse osmosis system, you get 10 gallons of water a day. You can wash the food that you're going to eat, and you can cook the pasta and the foods that you're going to take in using that water. I want you to seriously consider that and talk about it after the show, and go out and buy one of those. What I want to tell you a story about something that I read. If you don't believe that thing with the water, oh, the water's okay. I like to fish. and I get a magazine from the New Jersey Game and Fisheries Wildlife Bureau. And in that, I was reading the other day the recommendations for how frequently you should eat the fish that are in New Jersey's waters. They're talking about the salt water, and they were talking about the trout that they stock into our streams. And you know what they said? They said you shouldn't eat the trout that you catch in our streams any more than once a week, because any more than that, you're going to build up a toxicity level by eating too much of that fish. Then I'm thinking to myself, the fish didn't grow in the water. The fish has been grown in the fishery. It's really only been in those waters, in those lakes and streams, for 50% of them get caught within the first week. So it tells us that the fish don't have to be in the water very long for them to accumulate the poisons that you eating is going to cause a problem for you. So really think about it. It's one of the things that you're going to have the most control over. We can't control everything around us, but you want to make sure that your water intake is as pure as possible. And also, by drinking more water, we also normalize the bowel system a lot more, and we have a more normal transit time. What we're going to do right now is that we're going to go to the chart, and we're going to explain some basic anatomical anatomy to bring us all up to date before we go on with talking further about the lower bowel structure. Now we're going to go along our chart here to explain some basic functionings of the gastrointestinal system to bring us all up to date. Now, of course, we know that it starts at the mouth, and when you take your food in, you're going to chew it well because digestion of starches occurs in the mouth. It takes approximately anywhere from 3 to 5 seconds from the time that you swallow to before the food actually gets into your stomach. Now, the stomach is very flat. It's like a pancake and has an amazing ability to stretch, and that's usually what gets us into trouble with eating habits, because you can fit so much food into the stomach. The food can be in the stomach as little as 20 minutes, but it's not uncommon for the food to stay and remain in the stomach for anywhere from 3 to 5 hours before it gradually leaves the stomach. There's numerous acids that are in the stomach. Hydrochloric acid, it's breaking down proteins and other food products to move further along the alimentary canal. From there, gradually, the food passes by the sphincter of Oddi, which is a valve at the opposite end of the stomach, into the small intestine, and is then going to enter into the small intestine. The small intestines in length are approximately 5 to 6 meters in length, so that's a pretty long ways. Now, as that goes into your small intestine, certain enzymes are being put in. We have bile from your liver that's going in there. We have enzymes related from your pancreas that are helping you digest as it moves along. And as it goes into the small intestine, gradually through peristalsis, or what we know is the normalized movement or motion of your gut, it's going throughout the course of your small intestine. Now, the small intestine has in the interior of it something called villi. Villi are small outcroppings that allow for the exchange of nutrients into the system. Gradually, these nutrients are absorbed into the system, and the food ends up going after approximately 4.5 to 5 hours from the small intestine into the large intestine. It enters, as you may recall from our last month's program on visceral manipulation, it passes by the ileocecal valve. This is a valve between the small intestine and large intestine, which it responds to the gastric reflex when it's opened, and also it's mechanically stimulated with peristalsis to open as necessary. The first portion of your large intestine is known as the cecum, and this is where your appendix is attached to. Then we have the ascending portion of the large intestine, the transverse portion that comes across your abdominal belly, and then we have the descending portion of the large intestine that goes into the pelvic area, into the sigmoid and anal canal, and then out into the rectal area. The the flexures in the large intestine are known as the hepatic flexure, that is on the side of your liver, and then on the opposite side, the splenic flexure. Now, the normal length of the large intestine is that if you stand up and you lift your arms to the ceiling, the length of your large intestine goes from your feet all the way outcropping to the end of your fingers. That's the normal length and duration of the large intestine. What we see with the large intestine is it has a different cellular structure than what normally occurs in the small intestine. And the functioning of that large intestine is to, number one, resorb water back into the body so that fecal matter can start to be condensed to a greater degree. Secondarily, it is for the absorption of additional nutrients and the absorption of certain vitamins that have a tendency of just being manufactured in the large intestine and absorbed. The normal duration of time for the transit within the time that you eat something to the time that it comes out your rectum as waste product is approximately a 24-hour period of time. Having one bowel movement per day, or from what the time that you eat to the time it comes out, should be approximately a 24-hour period of time. The first condition that we're going to address today regarding the large intestine is chronic constipation, which is endemic within our society because of our poor diet. It can also be caused by congenital factors, meaning a naturally slower GI tract. Also, you could be born with a much larger colon than another person, which would naturally have a tendency of being able to hold a much greater amount of fecal material before it's being stimulated to void. If you want to help chronic constipation, there's numerous things that you need to do. Number one, if you're overweight, you have to lose the weight. The constipation and being overweight goes much more hand in hand than thinner people with constipation. So I want you to lose any additional weight that you don't need. Secondarily, is that I want you to walk twice a day. You must walk first thing in the morning, and then you must walk after dinner. I'm not telling you how long you need to have to walk, but I think 15 to 20 minutes as part of your regular program would be very good and normalizing. The other thing is to have a large glass of water before you go to bed at night. You don't necessarily need to take it to bed with you, but what I do is I normally put a container of my reverse osmosis water right by the bed, and I want you to get into the habit of that. That will help to keep your GI system well lubricated. The other thing that you need to do is that if you have weak abdominal musculature, you need to strengthen that up at all means, because by having strong abdominal muscles, you're increasing the intrathecal pressure. That's the pressure within your abdomen that makes it assisting from the outside to move things along at a greater rate. One thing that I am able to do using acupuncture for people that intrinsically have slow peristalsis is that we can do acupuncture, and that acupuncture will actually increase the peristaltic motion, because acupuncture is a tool of balance, and this is something that's very, very important for you to recognize. The next thing to address would be chronic diarrhea. Now, chronic diarrhea can be caused from a whole host of factors, from having an intestinal virus, having a parasite, having an inability to digest appropriately, having an enzyme problem. So that has a tendency of being a heck of a lot more complex. But usually people don't come to see me in the first step for chronic diarrhea. They've usually been through the course of events that deal with going to an internist, having a colonoscopy done, having an upper GI series done, trying to find out using conventional medicine what the underlying causes for this are. When people come to see me, it's because they're at their wit's end and have not gotten these things resolved through just other forms of therapy, whether it be antibiotics or steroids, or for irritable bowel syndrome or colitis or regional ileitis. So this is what I recommend that you do, is that you need to have a hair analysis performed. And it's a hair analysis. We take a sample of the hair And what that does is it's broken down by a mass absorption spectrophotometer, and all of the minerals that have taken in your diet, along with toxic minerals, over the course of the length of your hair, and then in the case of toxic minerals, over the course of your total lifetime, these are measured through that test. So about 85 different things are measured. From that information, we get an idea of what intrinsically your body is handling metabolic needs. The other thing to do is that you can have a stool analysis done, and characteristically, they are checking to see whether you have parasites or bacteria to see whether that needs to be treated medically. But what we find out is that if it's not that, we can still do a stool analysis that is sent to a lab called the Smoky Mountain Lab, where what they do is they take the undigested food particles and they find out what enzymes you may be lacking in. And these enzymes will give us an indication of where the underlying imbalance is metabolically. So potentially a stool sample to be done, definitely a hair analysis if you have any digestive disorders. I recommend it because it's the most cost-effective thing to get a tremendous amount of information. Another thing to do, and this is something that I do on a 3-month interval, I take a full spectrum digestive enzyme, and what that helps to do is it helps to give my normal glands that manufacture the digestive enzymes and the organs a chance to rest, a chance for those cells to rebuild themselves, so that your system isn't constantly being depleted with enzymes, so that the food that you do take in is much more likely to get broken down and absorbed to a greater degree. So digestive enzymes we're thinking about, hair analysis we're thinking about, stool analysis we're thinking about, and I want you to consider, a lot of people take supplementation nowadays, and what we find is that I see with taking x-rays as a chiropractor, I see a lot of the supplements that people are taking going in one end and coming out the other. On the x-ray, I'm actually seeing all of these supplements that you're spending a whole bunch of money on going right in one end and out the other. And for women, it's especially calcium. Everybody's taking calcium, everybody's concerned about their bone density, so they're taking calcium and you're taking it in a form that's not getting digested or absorbed. Taking it in a liquid form or a readily absorbable form is helping to ensure that you're going to bring the calcium to the area in which you need it. The other aspect that you need to consider is probiotics. Now, by the time you void, approximately 50% of the weight of that can actually be microorganisms associated with the aiding in the digestive process. There are bacteria, and they're friendly bacteria, Acidophilus, Lactobacillus, and numerous other friendly bacteria that inhabit our intestinal tract. What they do is they help to assist in breaking down the food, and in the case of the large intestine, it actually synthesizes vitamin K, and then vitamin K is absorbed through your large intestine. It's so important because it's related to blood clotting, can help in cases like leaky gut syndrome. So it's important that you have the proper probiotic nutrients put into your system. And the one that I recommend to people is that they take a product called Prime Life. That can be purchased at the health food store, and it's in the refrigerated section. If it's not refrigerated, it's not the product. So you're going to take Prime Life, okay? The other thing to do is that we've all heard of Montezuma's Revenge, where you go to a foreign place and we get diarrhea. It's not necessarily that the food or water there is bad. It's just different from what your body is used to. Somebody from Mexico comes up here, and they may very well get the same thing that we get when we go down there, because we're just not used to that type of bacteria. There's a war going on, and that war means the fact that your better bacteria is kept at a much higher check than any negative bacteria that could be causing you, chronic diarrhea or anything along those lines. So I want you to go, and when you go on vacation, you make sure that you take Acidophilus with you to make sure that these friendly bacteria are inhabiting your body in the right way. Also, it's very, very important that you take probiotic bacteria after any course of antibiotics. The reason for that is that the antibiotics are not just killing what the prescribed infection is, it's killing everything that's alive in your system as far as bacteria goes. So what you need to do is you need to replace the friendly bacteria. All of the time I see this, a woman gets a vaginal infection. The doctor puts them on antibiotics. It clears up. And what happens is that the woman ends up getting either chronic lower bowel problems, or the infection comes back because what happens is that the antibiotics wear off, and then it allows for the bad form of either yeast or bacteria to start to take over the system. There's also a lot of negative bad yeasts that inhabit the large intestine, and that can be also checked out by having a stool analysis performed. When does somebody have a colonoscopy performed? Now, this is something that people don't enjoy, so they don't have it done, but let me give you the parameters for colonoscopy. If you're 46 or older, you should have a colonoscopy be performed on you just as a baseline to make sure that everything is okay in there. A colonoscopy is the use of an instrument that goes through the rectum and is basically a television camera tube that allows for them to go in through the total length of your large intestine to see how everything is in the surrounding structure. Most cases, such as colon cancer, can be cured totally if caught early enough. Also, they need to inspect to see whether you have polyps, some things that can be removed easy before it has a tendency of turning into being carcinogenic. Another reason to have a colonoscopy done is if you have a history of large intestine problems in the family. If somebody else has had it, that would be another reason to be performed. Or if you have active problems associated with your lower bowels, bleeding, mucus in the stools, chronic constipation or diarrhea, irritable bowel syndrome, chronic fatigue, even if your stools are black, because this could indicate the fact that you have partial digestion of blood in that is coming through your system. And these are things that can sometimes be detected through a colonoscopy, but could be indicative of an upper GI problem. So keep these things in mind. The other thing is that the large intestine is an organ that helps us to detoxify, and as a result, it has a tendency of accumulating a lot of residual toxins that can be built up over the course of our lifetimes. Those residual toxins can be stored on the lining of the large intestine, thus preventing it from resorbing the water back into your system, keeping your body in a toxic state, making you have abnormal bowel habits. And for this reason, I recommend that people that have these symptoms or this problem undergo colon hydrotherapy. Colon hydrotherapy is a machine that is used on you by a trained practitioner that lavages, meaning basically cleans out the entire total length of the large intestine. This uses pressure, temperature, and a system of basically stirring up everything that lies in your gut. Doing an enema or taking some type of laxative is not going to make these things dislodge from the wall of your large intestine. Only through having colon hydrotherapy are you truly going to get yourself cleaned out of these poisons or toxicity. And if you had that hair analysis done and you're high in toxic mineral accumulation, that's one major source of where those poisons are lying. So that needs to be cleaned and cleansed out so that you're going to get normal resorption, so you're not going to have all that water retention, and you get that natural flow. You get all of that abnormal swelling that can then occur into the gut. You're going to get reabsorption of the nutrients to a greater degree. People can get fecal impaction to the point in which it actually calcifies within their large intestine and stays there. This is something that by using this process helps to clear all of this out. Now, sometimes the reason why people are chronically constipated is because they need to stretch open the large intestine like that to get that stuff out of there, that old fecal material out of there. So now the large intestine is soft and supple again. It can do its activity. It can move material along its way. Also, people that have problems in regards to strictures of the large intestine, meaning they can't have normal bowel movements, would benefit from colon hydrotherapy, because what happens is that they go and it starts to stretch the large intestine, the cecum and the rectal area, to the point in which things then can gradually start to normalize, and they can have normal bowel movements for, you know, then and in the future. So that's another reason for that to be utilized. But I'm going to leave you with this note in regard to colon hydrotherapy. A person goes for colonoscopy, and what happens is that they give you a special drink the night before for having the colon. You're going to have a drink the night before. It's going to help to clean you out, and that's going to make it so that they can see in there better. And you know what? It doesn't work all that well. So what happens is that I recommend that a person gets a session with a colon hydrotherapist, gets their large intestine cleaned out right before they go for a colonoscopy. If you're going to go through that procedure, that invasive procedure in that manner, you want to make sure that what the doctor's seeing, he can see. You don't want everything to be clouded, or you don't want material that prevents him from seeing a potential ulceration, diverticulitis, a disease or disorder that may be in the way. I want you to take all of this to heart and think dearly on that, along with changing your diet. And those changes in the diet are you're going to decrease the amount of fats and fried food in your diet, but you're also going to increase the oils in your diet, borage oil, flaxseed oil, essential fatty acids. These are good because they're lubricating for the GI system, but eliminate the fried food and junk like that. You're going to go with high complex carbohydrates. You're going to have 4 to 5 servings of vegetables per day, along with making sure that you have a lot of complex carbohydrates and low protein in the diet. Thank you for viewing. I'm Dr. James R. Golding, and we'll see you next time.